Hello, early birds. Welcome to our virtual stage. We're just going to give it a couple of minutes. You're actually before time, which is always good to see. Hello, Lopa. Great to see you.
Very good to see you, Eloise. How are you?
Good, thank you. All things considered.
Great to see you, Roopa. How are you?
I'm good, Lopa. How are you?
Very good, very good. Oh my goodness, I see a very old friend on this call. Arvind. My goodness, it's been ages. How lovely to see you.
Great to see you, Lopa.
Welcome, everyone. We're just going to give it a couple of minutes while people find the Zoom room. Feel free to join us on screen. It's always nice to have faces to look at. Equally, no pressure, or at least not much. Give it one more minute and then dive in. All right, people are joining thick and fast. We are just at 2 minutes past, so I think we will kick off. Welcome everybody to our March virtual stage. Our virtual stage is the Pandemic Action Network's monthly deep dive into key issues of the day, perhaps issues that we don't get to treat in the rough and tumble of our weekly and bi-weekly working groups. It's a place where we can step back and talk to experts and learn a bit more and have maybe a bit of a reset in our own thinking collectively on some key issues. We're delighted today to welcome some brilliant speakers, which I'll introduce in just a second. And we're focusing today on the disproportionate toll of the COVID-19 pandemic on girls, women, and gender diverse communities, which have really exacerbated and stressed entrenched gender inequalities. As many of you will know, an estimated 11 to 20 million girls would not return after COVID-19 related school closures. We've had 12 million women at least with disrupted contraceptive use, leading to lots of unintended pregnancies. And we've had 1 in 2 women reported that they or a woman they know experienced some kind of violence since the COVID-19 pandemic. And in the US, more than half of transgender and transgender people of color lost work hours, compared with 23% of the general population. These inequalities, these entrenched inequalities, have only got worse under the COVID-19 pandemic. So as we look to build back better, we need to make sure we do that in all senses, policy-wise, funding-wise, and making sure that we don't leave any communities behind. So as we look towards International Women's Day and think about the intersectional inequalities across gender diverse communities, I'm delighted to welcome today Lopa Banerjee, the Executive Coordinator, Generation Equality Forum and Director, Civil Society Division of UN Women, and Dr. Magda Robalo, former High Commissioner for COVID-19 Guinea-Bissau and President of the Institute of Global Health and Development. And I'll be in conversation with them, and then I'll turn to our close friend and advocate, Dr. Roopa Dhatt, co-founder and executive director, Women in Global Health, who will give some key takeaways at the end of this session. So without further ado, I'd like to invite into the conversation Lopa Banerjee, and we've got some guiding questions for this discussion. And I want to kick off by asking you, we know that the COVID-19 pandemic has set back hard-won gains in gender equality, and there are strong and shocking statistics to back that up. But that doesn't lead to action. In your view, why haven't these really stark gendered impacts of the pandemic taken greater prominence in the COVID response and recovery? And what can we do to change that? Lopa, over to you. And thanks for being with us today.
Thank you so much, Eloise. And it's great to be on this call with old and new friends. I'm delighted actually to share the platform with both Magda, whose contributions are going to be crucial, in particular also related to what I'm going to be saying, but also Roopa, with whom we've had a lot of conversations around. To your question, so to your question, Eloise, in terms of why has gender equality been so missing in the pandemic response? And the short answer to that is that while women have been in the forefront of the pandemic response, they have not been at the high table of pandemic decision making. This goes back actually to the fact that, the statistics that you cited. The fact is that the pandemic is a set of three interlocking crises. One, which is on the overall the jobs crisis, the enormous jobs crisis that has been created, because the virus has actually drawn attention to the long-term crisis around livelihoods. And with the virus, large swaths of women have been pushed back into economic unsustainability. Their vulnerability to shocks has expanded, and we have a care crisis. We have seen how much already the unpaid care and domestic work, which was already women were doing 3 times the share, that has skyrocketed, together with the disproportionate toll of violence that has resulted from the pandemic. And then the third, which is the climate and environment crisis. And the fact that, the climate and environment crisis, which is affecting everybody, but again, affecting women and girls most fundamentally in this. So this interlocking set of crises, jobs, care, and climate, but that is what the pandemic response should be. But we are not seeing pandemic responses that are actually addressing this interlocking set of crises. Women, just to give you an example, women comprise 75% of the health workforce, but they make up only 28% of health executives. Women's organizations have been at the forefront of community responses, but they are struggling with funding, shrinking space, et cetera, et cetera. COVID task forces that have, COVID-19 task forces, an analysis that UN Women and UNDP have done of 334 COVID-19 task forces from 137 countries found that only 4% have gender parity and 18 countries have no women at all in their task forces. So the current status quo of siloed response across livelihoods and climate is replicated in the COVID response, instead of addressing the magnitude of this complexity that we have seen from it. Over.
Thank you so much. That's very powerful. Jobs crisis, care crisis, climate crisis as other intersectional reasons why this has disproportionately affected gender and girls and women. Magda, would you like to come in on that question from your perspective, why the gendered impacts of the pandemic haven't taken greater prominence? We also heard from Lopa about not being at the top table. and if you have any ideas about how to improve that prominence in the COVID response and recovery. Over to you, Magda.
Thank you, Eloise. I'm happy to be here and particularly excited because I've joined Women in Global Health officially today. So happy to be starting my journey with this conversation around where are the women? I agree with Lopa that women were not at the table while the pandemic was and still ongoing. But the reason why the woman is not at the table, to me, is due to the culture. The culture of the institutions, the organizations, the culture at home is something so difficult to permeate. Bringing women to the table continue to be an afterthought. It's not by chance, it's not by design, it's by culture, due to the culture that only 4% of the task forces actually had gender balance, and 18 task forces had no women at all. Throughout the pandemic, we continued to see meetings, summits, where only men would appear in the pictures. Sometimes one or two women, yesterday, the day before yesterday, so recent. Despite all the cries, despite all the advocacy we are doing and we continue to do, because culture is something so entrenched in our institutions, in our homes, in our TVs, in our schools, in our boarding rooms, that we need to multiply by hundreds of thousands what we are doing. Our voices need to be speaking louder. We need many more voices before we can penetrate and break the barriers that keep the mindset of those leading the institutions, the parliaments, the global organizations. Probably we need, and some organizations do have, key performance indicators about gender balance in their institutions, but there are two easy justifications for not being able to do recruitment on a parity level and bring women up the ladder to the leadership positions. So to me, the work we are doing is great, but still not enough. No wonder it is said that it will take 130 years before we can achieve gender equality, looking at the current pace of things, the current level and degree of change that is happening worldwide. When you look at the COVID pandemic, and we look at where the women were, all over the place in the front lines, providing care, doing the plans, doing the budgets, doing the sensitization of communities. But when it came time for negotiating the vaccines, the funding, etc., only men were sitting in the room because of culture. And culture is the mindsets, the values, the principles, the very minimal things that manage and dictate our behaviors on a day-to-day basis. Unless we continue to build a new generation of women and men who understand what needs to change for us to be able to bring women at the equal level, we will not, the next pandemic will come, the other pandemic will come, and we'll still be even seeing countries where they are going backwards. There has been regression. I think Women in Global Health provided some data on the composition of delegations to the executive board of WHO, where actually we had less delegations with women leading into the executive council. So to me, culture is what we need to break for us to change the status quo. Over.
Thanks very much. Wise words and some good food for thoughts. So if we're thinking about best practice, I want to ask both of you, and I'll go back to Lopa now. Are there examples of countries, apologies, where I'm at my parents' house and they have the most crazy phone ringing operation, which I've spoke to them about, and this will give me good ammunition. Are there examples of countries, regions, or institutions that are effectively applying a gender lens to their COVID-19 response and recovery plans? And how are there sort of best practice examples of the holistic approach to incorporating gender elements? And have you seen that anywhere in the way that individual countries or regions have responded to the pandemic, or indeed in the nascent conversations around Build Back Better, etc.? It'd be great to hear if there are sort of glimmers of hope and ones that we can take of as best practice and learn from. Lopa, over to you.
Thank you. Thank you for that question, Eloise. So, let me actually talk about what does a holistic response look like specifically in terms of, some very specific ways in which response needs to be prioritized. Of course, we've just, Magda spoke about it, you mentioned it earlier, we all know on this call that, we need to be looking at building broad, and that has come through repeatedly through the response during COVID. And that is that we need to build broad coalitions of support for response. This is not going to be done in no one sector or one organization or one approach will work on this, and it needs to be intersectional. But intersectional across what? So let me just go through a few things. Number one, jobs need to be prioritized. Women's access to decent work, social protection, and food security needs to be ensured as part of a people-centered economy that is addressing the inequalities that exist. Number two, care has to be prioritized. And this means public investments in the care economy as a key part of the economic recovery from COVID. Affordable care services, which are not only critical to support women's re-entry into the labor force, but also in terms of support to children and older persons in order to drive a job-rich recovery. Third, climate change. This needs to be tackled at a sort of at a galvanized radical action level, looking at green economies and to harness this in terms of a transformative approach to the crisis. Fourth, we need to look at a very, very strong focus on how do we ensure women and girls' full and equal participation in the leadership in public life and leadership around decision-making and contribution to this public policy development from COVID. In terms of, are there good practices? What I want to talk about the Feminist Plan for Sustainability and Social Justice that UN Women launched in terms of what does a gender equality centered preparedness response policy and action plan look like? And it lays out this vision of this comprehensive kind of approach. There are some countries who are looking at this in different ways. There have been a number of countries, both Global South and Global North, that have looked at different aspects of this. Some have looked more at care. Some have looked at some critical responses around gender-based violence. Some have looked at some of the aspects around prioritizing leadership. But the comprehensiveness of this approach going forward is still not at the scale at which we need, and therefore we are still seeing the economic recovery still lagging behind. Over.
Thanks so much, Lopa. And Magda, it'd be great to hear from you on those best practices and if there are glimmers of light for us to learn from. Over.
I think there are very few countries that actually had good practices in terms of prioritizing, either by chance or by design, prioritizing women leadership into the response to the pandemic, and probably will be continuing doing that in terms of preparedness for the next pandemic. But we have also seen a regression in that process, and the number of countries and regions where that happened are still very small in numbers to actually make an impact and make a difference. But of course, they inspire us. And then we always can go back and then see what lessons can we learn from these places. I think there are a number of countries in Europe and even in Africa, my own country. I had the opportunity to see in person how a perfect parity government was overturned to bring in a government full of men, and women leadership wasn't being prioritized. I was leading the COVID pandemic response, and I could see how difficult it was sitting in the government boardroom to negotiate some of the responses and policies that needed to be put in place, which will also take care of the special conditions that women were facing on the social and economic front. But let me say that your question calls for several tiers of answers. There is not going to be one size fits all. We have different layers of women in different conditions, and we need specific approaches to those different layers. Otherwise, if we apply a blind strategy to all the specific problems that women within a country, within a region, and globally are facing, we are not going to succeed. If I look at, for example, the lower level of women who are even not in the healthcare space right now, but they're aspiring to probably become a nurse, become a doctor, etc. They struggle to get into university because they can't afford school fees. What policies do we need to put in place to support those women so that from that bottom level, that entry level, they can move up so that 100 years from today, they don't find themselves at the same struggle we are in today. When you get to the middle of that ecosystem, women who have graduated and they are in the jobs, they are struggling, they are talented, intelligent, and they want to contribute more, but they are not given the chance. What do you do with those women? And the problems in Africa, of course, are different from the ones in Europe, in America, in Asia, etc. You really need to be crafting specific, context-specific policies to move women from one layer to the other. Those who are already on the job, they need supportive environment, not just a supervisor who might be maybe pro women and will decide to promote them to a leadership position. We need policies, we need laws, we need enforcement. If you look at what's happening in politics, I think politics is the area where we have seen progress moving faster than in the healthcare environments. They resorted to quotas in order to open the doors for women to get seats in parliament. Of course, this is also an area where progress sometimes is not so fast, and regression is often the tune of the day. But we need to see deliberate efforts, policies that will enforce the middle level cadres to be able to move up to leadership positions. Then you have those women who are already in the peripheral space of power at the national and global level. But the struggle to get into the boardroom is of a different nature. So the challenges are asymmetric. We need to probably do a better assessment to get a better understanding. What are the limitations for each one of the levels, and come up with tailored measures or specific policies and strategies to get into that. We might say, well, we have done that from Beijing, even before Beijing, 25 years ago, here we are, things are not changing. That's very true, but the world is changing. The digital world we are living in today is so much different from where we started, even 10 years ago. I look at my daughters and the way they interact, the way they perceive what are the challenges today, achieving what they expect to achieve in life is totally different from where I started. We need to contextualize the world we are living in and then see how technology, how social media could be a tool and could also be one of the major challenges we have to counter in order to, the faster we go, this makes me think of COVID, for example. Facts and data were running slower than fake news. So we really need to sharpen our strategies, adapt them to the modern world and start thinking and beyond 2030. How would the world look like? What kind of strategies we will need in 2040? Start defining them today so that the girls who are now leaving primary school will not find themselves in the traps we are in current state. Let me stop here for a moment. Thank you.
Thank you, Magda. That's an excellent bridge to the next question I have for you both, which is thinking ahead and thinking about how to embed gender equality in the best way in the Build Back Better agenda. How can we ensure that investments in pandemic recovery and preparedness leave a better legacy for gender equity and equality and related intersecting issues? Lopa, over to you for that one. And before you start to answer, I just want to say, after panelists have come back on this question, we'll be opening up to the floor. There's some excellent materials in the chat showing exactly how much knowledge and depth you all have on these issues. So please don't be shy with your questions, pop them in the chat, get ready to put your virtual hands up, and we'll come to you in a few minutes. Lopa, over to you on gender priorities for Build Back Better.
Thank you so much. And there were a couple of questions in the chat. My colleague Victoria has posted the Feminist Plan for Sustainability and Social Justice that I referred to earlier in my comments, that focuses on sort of what a gendered response to the pandemic looks like. But to your question, Eloise, what does a gendered response look like in terms of the way forward? So 3 things. Number one, promoting women and girls' full and equal participation and leadership in public decision-making, so as to make sure that the response actions are informed by the policy and voices and solutions that women are already employing at the community level. Number 2, expanding the gender responsive finance at scale for preparedness and response action, and to make sure that we are reaching women's organizations, enterprises, and cooperatives through this at-scale financing. Number 3, building women's resilience and increased capacities in the context of community and national responses. In short, that gender equality outcomes are a central piece of pandemic preparedness and policy solutions. And I want to give an example over here. As you know, I am the executive coordination of generation equality, and I cannot leave this stage without talking about generation equality and the modality of acceleration that it employed or is employing through the multi-stakeholder partnerships across sectors. So, for example, the Global Alliance of Care that was launched as part of Generation Equality with a number of states and civil society and private sector actors that are part of this. This is looking at that link that I had talked about earlier, bold actions for care, livelihoods, and climate coming together around policy prescriptions for care as part of not just the Build Back Better, but overall sustainable for the acceleration of the Sustainable Development Goals agenda. So essentially, my final thought on this is on the way forward for pandemic response is that, you know, to advance at greater scale the sort of multi-sectoral, multi-stakeholder dialogues that are necessary with women and girls policy knowledge and lived realities driving it in terms of ensuring that that women's leadership and experience is informing the pandemic preparedness and forthcoming pandemic prevention responses towards building back, not just building back better, but building back equal.
That's really great. Building back equal, not just better. Magda, over to you for your thoughts about how to embed gender equality and equity into the Build Back Better agenda. Over.
I agree with the points made by Lopa. I want to add or maybe insist on the economic leg of the Building Back Better, Equal, and I'll add smarter. We need to include in our advocacy or strengthen our voice in calling for economic empowerment of women. It is often done as a way of small initiatives, small projects, little money here and there. We need to be deliberate about economic empowerment. Women have been disadvantaged in terms of their economic conditions during the pandemic. losses on the economic front, particularly women in the informal sector. And it's even difficult to measure the losses these women had. And as a consequence of that, their children couldn't go to school, probably will drop out of school, their health care and conditions will deteriorate, they can't afford health, etc. So I think we need to, as the economic recovery plans are designed, approved, and financed, we really need to be making sure that they have pro-women strategies, that indeed those entrepreneurs, those who benefit from the economic recovery plans are at least 40 to 50% women. If women don't recover economically, we are not going to build back better, equal, and smarter. The other element I want to bring in is primary health care. We need to be more aggressive in terms of implementing the pillars of primary health care. The COVID pandemic itself was a failure of primary health care being a robust enterprise in most countries. If we are to build back better, primary health care needs to be at the center of the efforts to build back. Probably it's going to be rebuilt, not built back, but we need, because if we build back on what we were doing, we are not going to succeed. We need to look into what part of the back do we want so that we rebuild smarter, equal, with social justice and fairness. Just to conclude, I want to talk about two important elements of the broader context. Is the increasing attempts or even the change in the democratic spectrum of exercise we are seeing across the world. Democracy is kind of moving backwards. Multilateralism is something else that we also need to be fighting for. Only with multilateralism we will be able to push our agenda forward. So we need to have those two cross-cutting elements as part of our agenda. The world needs to be multilateral. Democracy in the countries need to prevail. If there is no democracy, it is much more difficult for women to thrive and realize their potential. I'll stop here.
Thank you, Magda, showing again the interconnectedness of so many issues and the importance of not siloing. I'm pleased to say there's lots of questions in a lively chat. I will try and take us through some of those. So an opener from Autumn, what concerns you most about the fallout from this pandemic? What keeps you up at night? And then there's a few along the same lines, which are about what are the specific global or national policy outcomes that the Pandemic Action Network and our partners can rally behind to promote gender equity through PPR. Similarly, Courtney asks about formal multilateral processes and their potential utility here, for example, a WHO pandemic instrument. So there's more, but let's just carve those ones out. So global, national, multilateral processes and what we should, concrete things we should get behind, and the sort of punchier answer on what's keeping you up at night. Lopa, over to you.
You know, I really want to start with what Magda ended up with, because I cannot agree with her more, and including around some of the questions around democracy, because, you know, we talked about in so many ways this climate care and livelihoods crisis, and the fact that, you know, we are not seeing the sort of, you know, coordinated responses is because also of this the enormous crisis that we're facing around multilateralism and around democratic erosion. Now, you know, the fact remains that the democratic erosion or the multilateral crisis is not just coincidental. It has happened as a result very deliberately of moving of vested interest, including those that have come to political power, moving away from the concept of sort of global good, public good, into much more specific, vested interests, and that has been a process that has been ongoing for a very long time. What is really interesting is during the pandemic, when the way the world shut down and the joint action around addressing the pandemic in terms of work from home, stay at home, shelter at home, all of these aspects which the world did together, and therefore drawing attention to the fact that global action is possible. But global action, happens when it was this type of a crisis. But again, that same level of global solidarity that was presented by leaders in terms of leading on that kind of shelter at home was not then present in looking at common level solutions. So simultaneously, the focus on supporting, strengthening civic engagement, feminist activism, and as a result of that, women and girls in positions of decision making and power, that is basically a shift in power. That shift in power to looking at greater participation of citizens in the decision making around their lives is about democratic dividends. That is about expanding democracy. And so that hand in hand of democratic expansion together with pandemic responses that address very specifically to the question, very specific outcomes in policy related to women's leadership in decision-making, specific outcomes as part of pandemic action plans, women's leadership. Number two, looking at violence prevention as essential services, as essential part, as essential healthcare in terms of primary of response, looking at care and social security and addressing care as essential to policy responses around pandemic. These are some of the ways in which very specific policy responses around the pandemic recovery can be looked at in order both to address this democratic erosion and to address the intersectional and comprehensive response. Thank you.
Thanks very much, Lopa. Magda, do you want to come in on those questions?
I think what I would like to say regarding that is to point to the issue of accountability. We need to hold people, institutions, donors, implementers accountable. We need to name and shame. if accountability, if people can get away with it with no consequences, we will be in the same starting point or even further down the line. I think accountability is key both at the global, regional, national, and local level. And it brings back the issue of democracy, which I will not go back to. I think Lopa expanded on that sufficiently. The other element I wanted to refer to is transparency and trust. Trust is a value that has been eroding between communities and governments, between neighboring countries, between donors and partners, between different groups fighting for public goods. I know building trust is not something that happens overnight, but we need to set the first stone in rebuilding trust. You may be in a remote village in a country. You can build trust with the communities in that village by delivering on what you have promised. If we are an NGO and we are working in a community, with a community, we should deliver on what we have promised to deliver and not use the communities to take nice pictures and go back for funding to say, I've done this, I've done that. We can have a full webinar on this topic. I guess what I'm trying to say, we need to be true to our agendas. And it boils down to the issue of accountability and transparency. Thank you.
Thank you. Really powerful. I want to now bring you to David's question in the chat, which, David, in fact, why don't we give them a rest from our voice? Would you like to read it yourself?
Yeah, sure. Interesting session. Excuse me, David Bryden with Frontline Health Worker Coalition. So my question is, if you think about the power relationships, donors have a lot of power, a lot of influence, sometimes for better, sometimes for worse. But my question is, do you feel that the major donors in the COVID response have done enough to reflect gender in their planning? So specifically, if they're receiving a request for resources to help from a country to help implement a vaccine deployment plan, have they been saying to the country, well, very nice, thanks so much for your plan. There's a lot of good elements here, but tell us more about how you're reflecting gender balance in your planning committee. Or can you tell us more about how you're addressing the needs of community health workers, the majority of whom are women? So I guess my question is, are you seeing them use that influence? I mean, I'm thinking particularly of USAID and Global Fund, but also the UN agencies, UNICEF, and also Gavi.
Thanks, David. Great question. And just before you answer, I guess there's something about a crisis as well, which makes all of that really hard for people to want to kind of stop and take stock and do that kind of thing or reroute. And it shows the importance of us doing that hard, slow work all of the time, so that when it comes to a crisis point, we have the gender parity, we have the gender equity, because in the rush of a crisis, isn't there a risk that that shouldn't be the case, but that gets looked over even more? I'd love to hear your answer to David's questions. Magda, do you want to come in on that?
Yes. First of all, let me say that in Guinea-Bissau, we we collaborate with the US government, even though we don't have USAID in the country, but we have some of the major UN agencies. It was an afterthought, 20 months after the beginning of the pandemic, that we started receiving questionnaires. Say, oh, what's the gender lenses you're applying to your planning, to your funding, etc. Well, before that, when we started vaccinating, I started realizing that women were not, the coverage, vaccination coverage for women was much lower than for men. We looked into the data and then we changed our strategy in order to reach women. We had partners who quickly joined us to fund an initiative to place vaccination teams in the markets where the women were. They were not being vaccinated because they could not afford to not sell, just to go and then get vaccinated. So we brought the vaccination tables to them. I think this is going to be described in a World Bank report that is about to be published. We had a deliberate action on ourselves to address the gender, the vaccination gap between men and women in Guinea-Bissau. It was only 2 months ago that we started receiving questionnaires from particularly UN agencies, wondering what kind of gender-related strategies we were applying to counter COVID-19. But this brings me back to the point about culture. If you look at the composition of UN heads of agencies, and I'm picking UN agencies not for any particular reason, but just because they constitute a larger group of organizations where you have several representatives. Most of them are male. So there is, even not at that level, an effort to have a parity in terms of gender representation for the agencies in the country. And this brings me back to the point about accountability. If we start holding these agencies accountable for how do they apply gender balance in appointing in their organizations and have key performance indicators to measure what we are doing, I think we will have a different scenario in a shorter period of time. This is not going to be a magic bullet, but it's just one example of one of those things that we can do. Over.
Thank you, Magda. Lopa, anything to add on that? Have you seen in practice this pushback to say, actually, you've not done enough on gender equity, or the insistence of donors or partners on stronger, more robust gender equity in planning and delivery?
So the short answer to that, to David's particular question of donors and ask, is actually no. But that said, let me just also address it in a slightly different way. And the example that Magda gave of Guinea-Bissau actually is exactly what we're talking about. Magda was the High Commissioner for the COVID-19 response. The fact that her, as a leader of the COVID response in Guinea-Bissau, she was able to, with her team in a position of leadership, bring that perspective of how the vaccine distribution was leaving women out of it. It's because this is exactly what we mean by women being in leadership positions around the pandemic response and how it affects it. But I want to go back to David's point a little bit, and then Magda, for the first time, I'm going to actually present a point of view a little different from what you said. But to David's point also around the donors, I do want to say, while the point is valid in terms of, as we are looking at those countries that are stepping in to support vaccine rollout or vaccine equity in other countries, and indeed studied the issue around, gender parity or gender responsive leadership around pandemic has not been one of the criteria. That said, the major response from this should be actually, yes, certainly donors, but more importantly by countries, because countries themselves are leading their pandemic responses at country level. So the focus for countries themselves and for countries to be held accountable by the citizens and the accountability measures of those countries around the pandemic response in terms of a gendered response. That is absolutely crucial. My last point on this is within the UN system, the Secretary General has prioritized parity. And actually last year, Magda, this is what I wanted to say. Last year, the Secretary General's senior leadership team, which actually includes the heads of UN agencies, was achieved parity for the first time in 75 years of the UN. So actually it is a parity team. That said, one of UN Women's roles is to see how the UN works better on gender equality as a UN system. And this is still an uphill battle. So in that sense, going back to that point of even within the UN, as we look at a pandemic response, as a coordinated UN pandemic response, while we have been focusing on gender equality at the center of it. But the expression of that, even in terms of the work that we are doing, still has a ways to go. Over.
Thank you so much, Lopa and Magda, for your brilliant thoughts and knowledge today. I want to turn now to Dr. Roopa Dhatt to give us a couple of minutes of key takeaways that you've taken from this conversation, Roopa, and we're delighted to have you. Over to you.
Thanks, Eloise. And it is going to be such a challenge to summarize this because both Magda and Lopa have said such insightful points, but also very interconnected. And I still want to acknowledge the last question that came, has enough been done? And I want to begin with that and lead with that and say that not enough has been done. And that has been a message that has come through, whether it is through Magda's reflections from the national response, engaging with donors, engaging in the multi-sectorial space, but also Lopa's point about, yes, we have plans, good examples out there, but yet these are not being scaled up. So what is a gender responsive approach to pandemics? Well, first, we need to look at our culture. Are we ready to break that culture? Are we really willing to change our mindset, values, and principles? And first and foremost, start valuing women and seeing them as leaders and really having inclusive decision-making at all levels. So that's the first key takeaway that really stands out, and a lot of work to be done. Data has shown us over and over again, women's expertise are being sidelined, yet women are 70% of the health workforce, 25% of leadership roles in health. And yet when we look at COVID-19 task teams, less than 5% have gender parity, and 18 countries with not a single woman. And I have to say, as someone that is a US citizen, the first COVID-19 task team in the United States had, even though there were 20 plus members, had no women. So we have a lot of work to do, and it shouldn't be an afterthought. The second thing that really stood out is, about being holistic, comprehensive, and scaled up. There is an agenda that UN Women presented on jobs, care, and climate, an example of an integrated agenda, but also being multi-stakeholder, multi-sectorial, and Magda pointed out to the new realities and the new context, leaning into the possibilities of digital solutions and innovation in ways that we haven't before, to really, not keep doing the same things over and over again, but learn from each disease outbreak, each health emergency, each epidemic and pandemic. And so as we look to building back better, but also building back different, building back equal, looking at the negotiations that are going to be taking place around a pandemic accord, treaty, whatever that next will be, we need to really think about a holistic way. And the third part is really around, how do we get pragmatic and practical? And that is about integrating gender responsive policies into our pandemic systematic response. It needs to be included in strategies. Some countries in some national and multilateral and regional plans have gender mentioned, but is that being backed by funds actually going to that work? So this needs to be funded at scale. Gender outcomes need to be part of the performance measures, and that's not happening. And we need to really make sure that as we are looking at integrated gender responses, the financial flow and support is getting into the hands of women's groups and community groups, movements at the community level. And there was so much more said, but I would say to all of you as we start, today is March 1st, in many places being recognized as Women's History Month, but also at Women in Global Health, we're saying let's make it a month of action. Let's all commit to taking action and looking at our own policies, our own call outs, our own advocacy efforts in this community. And let's make sure that we have language in there that includes requests for gender parity. Let's make sure that we are acknowledging the gender dimensions, and not just as in the context and problems, but in the solutions part. And third, we know that the World Health Assembly is right around the corner. We know that the pandemic intergovernmental negotiating body only has 1 out of 6 members being a woman. So what are we all going to do to make sure that there is a gender responsive approach, but women's perspectives at the table? So that's my challenge to all of you. Turning it to you, Eloise.
Thank you so much, Roopa. And I just wanted to acknowledge Anam's question in the chat about how do we change society's stereotypes about women around the world. And I think, apologies for missing that question, but I actually think a lot of what Roopa said and what our panelists have said about changing the culture is hugely important there. And also women at the table, diversity at the table, which tables, all of them, from the very on the ground decision-making processes, frankly, to the top of the G20 and everything in between. And it strikes me that as we look as the Pandemic Action Network, and where we want to break down silos, we want to make sure that every organization, every individual has the tools they need to fight the pandemic. We need to make sure that we're breaking down our own silos across those networks and make sure that we integrate these gender equity principles in everything that we do, and that we give people the tools they need. We really need to de-silo our sector more broadly. So thank you all for this really rich conversation. We will be returning to this, no doubt. Thank you to our brilliant panelists, Lopa, Banerjee, Dr. Magda Robalo, Dr. Roopa Dhatt. We've been so pleased to have you share your wisdom with us. Thank you to the participants for amazing comments and resources in the chat. We'll save them all, and wishing you all an excellent rest of day. Here's to equality, here's to equity. Lots of work to do. Let's stay in touch. Thank you so much.
Thank you very much. This was great. Thank you.
Thank you so much. Bye-bye.
Thank you for having me. Bye.